everyone, today we'll be studying about the anatomy of the female reproductive organs. First we'll study about the ovaries, then the fallopian tubes, and finally the uterus. In uterus, we will study about the supports of the uterus, which is a very important topic. First, we will just fastly go through the anatomy of the ovaries and the fallopian tubes. These are not very important for your exam, but you should know them just in case a question comes. Okay, so we will study only the important topics, important points from these topics. First, we have the female gonads. What are the ovaries? Ovaries are female gonads. Matlab, these are the site for oogenesis. These are the site where oogonia are produced. That means a female ovum is produced. Okay, so these are two in number. We have a left ovary and we have a right ovary. Right? Where are they located? They are located in the ovarian fossa. Ovarian fossa is bounded anteriorly by the obliterated umbilical artery and the posterior boundaries by the ureter and internal iliac artery. You have to learn this. Okay. So the ovarian fossa, as you can see, this is the posterior, this is the ureter and internal iliac artery. And anteriorly, you have the obliterated umbilical artery. Okay. So this is about the location. Now, one more peculiar point about the ovary is that the position of the ovary is variable. What do you mean by variable? So in a nulliparous female, the ovary is vertical. Okay, it is vertical in a nulliparous female and it is horizontal in a multiparous female. Now, what do you mean by nullipara? Nullipara means a female who has never given birth to a baby before. Okay, so in a nulliparous female, the ovary is vertical. We have an upper pole and we have a lower pole of the ovary. Whereas in a multiparous female, the ovary becomes horizontal. So the upper pole now points laterally and the lower pole points medially. Okay, so then now let's study about the different characteristics of the ovary. So first we have two poles in the ovary. ठीक है, तो ovary के दो poles होते हैं. एक as we have already studied, एक है upper pole. This upper pole is close to the fallopian tube, so it is also known as the tubal pole. Then we have the lower pole, which is close to the uterus, so it is known as the uterine pole. So upper pole or tubal pole and lower pole या फिर uterine pole. Then we have two borders. The borders are anterior border. Anterior border is also, this is the anterior border. Okay, so anterior border is also known as the mesovarium. Why is it known as the mesovarium? Because it is bounded to the mesovarium. We'll study about that later. Then we have the posterior border of the ovary. The posterior border of the ovary is the free border. Okay, it is free. Then we have two surfaces. We have a medial surface and a lateral surface. So very easy, two poles, two borders and two surfaces. Okay. Now the ovary is entirely covered by peritoneum except along the anterior border. Along the anterior border, we have, see, this is the anterior layer of broad ligament. This is also known as, it is connected, so this is the anterior and posterior layer of broad ligament. Now this ovary is connected to the broad ligament through another peritoneal fold which is known as the mesovarium. Okay, so mesovarium is, in a sense, it is a part of the broad ligament only, but since it is connected to the ovary, it is known as mesovarium. It connects the ovary to the broad ligament. Understood? Next, we have another ligament which is related to the ovary, that is the suspensory ligament of ovary, also known as the infundibulopelvic ligament. We can see in this diagram. See, यहाँ पर ovary से connected है suspensory ligament of ovary, also known as the infundibulopelvic diaphragm. Now, in this ligament, what is there? In this ligament, we have ovarian vessels and nerves. Okay, we have the ovarian vessels and nerves in the suspensory ligament of ovary. Now, what is the arterial supply of ovary? Very easy. It is the ovarian artery and branches of the uterine artery. Both of these are branches of abdominal aorta. Then what is the venous drainage? The venous drainage is a pampiniform plexus of veins. Now, around the ovary, a pampiniform plexus of veins arises, which eventually forms the ovarian vein. And this ovarian vein then either on the right side, it will directly drain into the IVC, and on the left side it will first drain into the left renal vein and then it will drain into the IVC. Okay, understood? Easy. Then we have the lymphatic drainage. Lymphatic drainage is into the lateral aortic and pre-aortic lymph nodes. The nerve supply is by the ovarian plexus. which consists of both sympathetic and parasympathetic nerves. Sympathetic nerves are from the nerve roots T10 to T11, and parasympathetic are from S2 to S4. You can remember these nerve roots or not, it doesn't matter. Okay. Then now you should always make a habit of adding a point or two about clinical anatomy at the end of every answer you write, because it will increase your marks. Okay, it will give a good impression on the examiner. So in case of ovary, what is the relevant clinical anatomy? पहला तो है ovarian cysts. So in many conditions, the cysts form in the ovary. Okay, you need not know the detail of it. Even if you just write the name, that's enough. And then you know there can be carcinoma of the ovary, so that is about that. So this was about ovaries. Okay, we first studied the location of ovary, then we studied about the two poles, two borders, two surfaces, then about the peritoneal relations of the ovary, the blood supply, lymphatic drainage, and finally the nerve supply, and then finally the clinical anatomy. I hope you all have understood it. Now let's move on to the fallopian tubes. Now fallopian tubes are also known as the uterine tubes or the salpinx. ठीक है, these are tortuous ducts. Tortuous मतलब क्या? Tortuous मतलब they are zigzag, right? So this means they are tortuous ducts which transport oocyte from the ovary to the uterus. So we all know that oocyte is formed in the ovary. It needs to travel up to the uterus, and here implantation occurs, right? So for this traveling, the tube which facilitates this movement is the fallopian tube. Now also fertilization takes place in the fallopian tube. To be specific, it takes place in the ampulla. Right. Now, where is the fallopian tube located? It's very easy. See, look, here we have the broad ligament. Okay. So, in the upper free border of the broad ligament is located the fallopian tube. Okay. Free upper margin of the broad ligament of uterus. Now, each tube is 10 centimeter long. This is an important point and often asked in vivas. Okay. Fallopian tube की length कितनी होती है? 10 centimeter. Now we come to the subdivisions of the fallopian tube. So first we have the infundibulum. Okay, infundibulum is the lateral end of the fallopian tube. It has various finger-like projections known as the fimbriae. See, this is the lateral end infundibulum, and it has various finger-like projections known as the fimbriae. Okay. Then we have ampulla. Now, ampulla is the lateral two-thirds of the fallopian tube. It is present medial to infundibulum, and it is the lateral two-thirds of the fallopian tube, around 6 to 7 centimeter. It is dilated and tortuous, and it is the site for fertilization, as I have already told you. Third is the isthmus. Isthmus forms the medial one-third of the tube, and it is rounded and cord-like. This is the medial one-third of the tube. It See, यहाँ पे tortuosity कम हो गई है. Okay, so it is rounded and cord-like isthmus. Then last part is the uterine part or the intramural या फिर interstitial part. What do you mean by this? That this part is within the wall of the uterus. ठीक है? This is the intramural या फिर interstitial part. This part opens at the superior angle of uterine cavity through the uterine ostium. This opening, this round opening is known as the uterine ostium. Okay. Now, um as we studied about ovary, उसका peritoneal fold was known as mesovarium. वैसे ही fallopian tube का peritoneal fold is known as the mesosalpinx. This is the part of broad ligament between the attachment of mesovarium and uterine tube. Okay, so somewhere here you have the attachment of mesovarium. Okay, and between this mesovarium and uterine tube, there is a ligament which is the mesosalpinx. Now we come to the blood supply. So you must remember, see यहाँ पर fallopian tube के division के time we did lateral two-thirds and medial one-third. But in case of blood supply, it is medial two-third and lateral one-third. Okay. So the medial two-third, as you can see from this diagram, it is supplied by the uterine artery, and the lateral one-third is supplied by the ovarian artery. Understood? Now similarly veins इसके साथ साथ run करेंगी, same veins. So uterine artery के साथ there will run the uterine veins, and ovarian artery के साथ पहले pampiniform plexus of ovary run करेगा, and उसके बाद it will form the ovarian vein. Okay. Now lymphatic drainage is the same, lateral aortic and pre-aortic lymph nodes. Another thing you can remember is that isthmus drains into the superficial inguinal lymph nodes. Okay. Now nerve supply, again you have parasympathetic and sympathetic nerves. Sympathetic is T10 to L2 nerve roots from the hypogastric plexus. Parasympathetic is vagus nerve and pelvic splanchnic nerves. This is a little bit of extra edge information. You can skip it if you want. Okay. Now again clinical anatomy, very important. So first is salpingitis. What do you mean by itis? किसी भी वर्ड के आगे अगर itis लग जाता है so that means inflammation. Okay, so salpingitis is inflammation of the fallopian tube. Then we have a procedure known as hysterosalpingography. This is the image of a hysterosalpingogram. ठीक है, तो इसमें क्या करता है, it is a radiological technique to visualize the uterine cavity and lumen of the fallopian tubes. So we will insert a dye from the vagina and then we will take multiple X-rays. ठीक है, X-rays में you will see this dye कि dye कहाँ कहाँ तक जा रहा है. Now अगर dye यहीं तक रुक जाएगा, that means that here you have a tubal block. This tubal block can lead to infertility. What do you mean by infertility? Infertility means that the female is unable to conceive even after unprotected intercourse. Okay, so it is used to diagnose infertility and various other gynecological conditions related to the uterus. Okay. Then another clinical anatomy is tubectomy. What do you mean by tubectomy? We all have studied that this is a permanent method of sterilization. In this, we cut the segment of fallopian tube on either sides so that the ova cannot be transported to the uterus. If the ova will not be transported to the uterus, the female can't become pregnant. Okay. So this was about the fallopian tube. Now we will study about the supports of the uterus, which is the most important topic of female reproductive system. You should not skip that. Okay. That is a must know topic. So let's start with that. Okay, so before looking at the supports of the uterus, first let's learn the basics of the anatomy of the uterus. Okay. So सबसे पहले what is the uterus? It is a child-bearing organ. Okay. So after implantation, the uterus bears the child throughout the 9 months. Where is it situated? It is situated between the urinary bladder anteriorly and the rectum posteriorly. So this is your uterus. In front of it you have the urinary bladder and behind it you have the rectum. Okay, it is pyriform in shape. Now this shape of uterus is very important. Okay, it is a pear shaped structure. Okay, it is pyriform in shape and its dimensions are also very important. So it is 7.5 centimeter long, 5 centimeter broad and 2.5 centimeter thick. Okay, so 7.5 into 5 into 2.5 centimeter are the dimensions. Now, what are the parts of the uterus? Okay, uterus is divided into four parts. The first part is the fundus. So, fundus is the part above the opening of the fallopian tubes. Okay, so this part is the fundus of the uterus. Okay, then we have the body of the uterus. This is the body of the uterus. Wait, this is the body of the uterus. Okay, body is basically divided into fundus and body. The body has an anterior surface and a posterior surface. Then you have the two lateral surfaces of the uterus, and finally we have the cervix. Cervix is connected to the vagina. Okay, so these are the four parts of the uterus. Then a very important part, what are the ligaments of the uterus? So we have peritoneal ligaments, matlab the peritoneal folds which cover the uterus, they also come under ligaments, and then we have the fibromuscular ligaments, matlab strong ligaments जो उसे support करके रखते हैं, ठीक है? तो पहले we will study about the peritoneal ligaments. Peritoneal ligaments में we have the anterior ligament. Now it is very easy. Okay, before that I forgot one thing. So there are various, and the uterus is not present in the body as a straight organ. Okay, it is present in angulations. So first we have the angle of anteversion. What is the angle of anteversion? It is the angle between the long axis of vagina and the long axis of uterus. It is around 90 degrees. Okay, this is the angle of anteversion. The second angle is the angle of anteflexion. Flexion means towards the midline, right? So the uterus moves towards the midline. So this is the angle between the long axis of cervix and long axis of the body of uterus. And this angle of anteflexion is 125 degrees. So you should remember this angle of anteversion 90 degree between long axis of vagina and long axis of uterus. Angle of anti-flexion is 125 degrees between the long axis of cervix and long axis of body of uterus. Okay, so now let's move. So the peritoneal ligaments are basically the ligaments which form peritoneal folds around the uterus. तो सबसे पहले we have the anterior ligament. अब यूट्रस के anteriorly क्या है? यूट्रस के anteriorly urinary bladder है, that is also known as vesicle. ठीक है, तो you have the uterovesical fold between the uterus and urinary bladder. Sorry, between the uterus and urinary bladder we have the uterovesical fold. Okay. फिर posterior ligament में rectum है, तो it is the rectovaginal fold. And then you have the right and left broad ligaments. ठीक है, broad ligament lateral surface of lateral border of uterus से attached होता है. ठीक है, तो anteriorly utrovesical fold, posteriorly rectovaginal fold, and then you have right and left broad ligaments. Now these contents of broad ligament are very important for enumeration type questions. ठीक है, total 10 contents होते हैं broad ligament में, and you should learn it by heart. सबसे पहले सबसे ऑब्वियस क्या दिख रहा है यहाँ पर हमें? फेलोपियन ट्यूब. तो फेलोपियन ट्यूब होगी, फिर राउंड लिगामेंट ऑफ यूट्रस होगा. ठीक है, दिस इज द राउंड लिगामेंट. देन यू हैव द लिगामेंट ऑफ ओवरी. हमने पढ़ा था ना इनफंडिबुलो पेल्विक लिगामेंट. ठीक है, दैट इज द इनफंडिबुलो पेल्विक लिगामेंट. फिर यूट्राइन वेसल्स, दीज आर द यूट्राइन वेसल्स. Ovarian vessels come from here. Then you have the uterovaginal and ovarian nerve plexuses surrounding them. फिर epuphoron and parophoron, ये दोनों remnants होते हैं. ठीक है, epuphoron and parophoron. Then you have the lymph nodes and lymph vessels, and finally the dense connective tissue या फिर parametrium. So you should learn these contents of the broad ligament. Then we have the fibromuscular ligaments. Fibromuscular ligaments में तीन आते हैं: round ligament, ट्रांसवर्स सर्वाइकल लिगामेंट एंड यूट्रोसेक्रल लिगामेंट, जो अभी हम लोग आगे पढ़ेंगे सपोर्ट्स में. ठीक है, तो इतना समझ आ गया यूट्रस के बारे में. सबसे पहले इसका शेप, साइज, देन द पार्ट्स ऑफ यूट्रस, एंगल्स ऑफ यूट्रस. Then we studied about the ligaments of uterus, peritoneal ligaments and fibromuscular ligaments. And the contents of broad ligament are very important. Now we come to the supports of uterus, which in itself is a 5 mark question. ठीक है, तो सपोर्ट्स ऑफ यूट्रस में सबसे पहले तो आता है, सबसे पहले तो व्हाट इज द सिग्निफिकेंस ऑफ सपोर्ट्स ऑफ यूट्रस. नाउ बेसिकली यूट्रस इज सपोर्टेड आगे से, पीछे से, medially, laterally, everywhere, from everywhere the uterus is supported, and it is like it is a hanging structure. Okay, it hangs in the pelvis. तो उसे हैंग करने के लिए साइड साइड से सपोर्ट्स है. अगर इनमें से कोई भी सपोर्ट यूट्रस का वीक हो जाएगा, so अगर ऐसा होगा तो the uterus will come outside of the vagina. This is known as uterine prolapse. ठीक है, it is a very common clinical condition which we see in gynae OPDs, right? तो यूट्राइन प्रोलैप्स हो जाएगा. वो किस वजह से होता है? जब ये सपोर्ट्स वीक हो जाते हैं. ठीक है, तो दैट इज द क्लिनिकल एनाटॉमी. ठीक है, दैट इज द क्लिनिकल सिग्निफिकेंस ऑफ लर्निंग अबाउट द सपोर्ट्स ऑफ यूट्रस. ठीक है, तो सबसे पहले वी हैव द प्राइमरी सपोर्ट्स ऑफ यूट्रस. तो प्राइमरी सपोर्ट्स आर आइदर मस्कुलर सपोर्ट्स या फिर इसे बोलते हैं एक्टिव सपोर्ट्स. ठीक है, मतलब इसमें सारी जो तुम्हारी मसल्स है ना वो इन्वॉल्व होंगी. तो मस्कुलर सपोर्ट्स ऑफ यूट्रस, एंड देन यू हैव फाइब्रोमस्कुलर और मैकेनिकल सपोर्ट्स. ठीक है, first we will study about the muscular supports of the uterus, muscular या active support. In this you have the pelvic diaphragm. This is the pelvic diaphragm. It has the pubococcygeus, iliococcygeus muscles, ठीक है, which are attached to the perineal body. So this the levator ani and coccygeus muscle. ठीक है, so the pelvic diaphragm. Then you have the perineal body. Now perineal body is a fibromuscular node, right? And उस पे 10 muscles attach होती है, and it forms a very strong base for the pelvis. ठीक है, अगर वो weak हो गया तो यूट्रस कोलैप्स हो जाएगा. तो पेरिनियल बॉडी में टोटल 10 muscles होती हैं. You should learn those 10 muscles. ठीक है, then you have the distal urethral sphincter mechanism. These three form the muscular or active supports: pelvic diaphragm, perineal body, and distal urethral sphincter mechanism. देन यू हैव द फाइब्रोमस्कुलर या फिर मैकेनिकल सपोर्ट्स. इसमें क्या क्या आता है? सबसे पहले जो हमने पढ़ा था अबाउट द यूट्राइन एक्सिस, एंगल ऑफ एंटीवर्जन एंड एंगल ऑफ एंटी फ्लेक्शन. एंगल ऑफ एंटीवर्जन वाज 90 degrees, एंगल ऑफ एंटी फ्लेक्शन वाज 125 degrees. ठीक है, तो ये दोनों एंगल्स पढ़े थे हमने, यूट्राइन एक्सिस. देन यू हैव pubocervical ligament, transverse cervical ligaments also known as Macken-Roth's ligament, and uterosacral ligaments. ये तीनों ligaments एंड राउंड लिगामेंट, ये सारे लिगामेंट्स हमने फाइब्रोमस्कुलर लिगामेंट्स में देखे थे, राइट? तो ओके, तो these ligaments, सबसे पहले हम लोग देखते हैं pubocervical. Now just as the name says, ठीक है, pubocervical मतलब pubic symphysis से लेके cervix में जाने वाला ligament. This is the pubocervical ligament. फिर uterosacral ligament, uterus से sacrum तक जाने वाला ligament, that is the uterosacral ligament. फिर transverse cervical ligament, जो lateral wall of uterus को lateral wall of pelvis से जोड़ती है, ठीक है. This is the transverse cervical ligament, also known as Macken-Roth's ligament. And then you have the round ligament of uterus. These are the fibromuscular supports. ठीक है. Then you have the secondary supports. Now these secondary supports are the peritoneal ligaments which we studied. Anterior क्या था? Anterior was uterovesical fold of peritoneum. Posteriorly क्या था? Rectovaginal fold of peritoneum. And right and left side में you have the broad ligaments. ये secondary support का काम करते हैं. Their function is not well established, that they don't play a major role in supporting the uterus, but हाँ, they are there. ठीक है. The major role is played by the primary supports, उसमें muscular या active support, which includes the muscles, and then fibromuscular या mechanical supports, which includes the uterine axis and the four ligaments. Okay, I hope you understood this and I hope you enjoyed this session. Thank you and all the best for your exams.